Welcome to the Department for Radiotherapy at the Cumberland Infirmary. The aim of this short film is to provide you with general information about radiotherapy treatment, to answer some of your most frequently asked questions, and to introduce you to our department and some of our staff who you may meet when you visit. We hope you find it useful, and if you have any further questions, please ask your oncologist, radiographer, or nurse. You will be looked after in the Northern Centre for Cancer Care, North Cumbria. If you are coming by car, the hospital is situated on Newtown Road. Approach routes to the hospital are signposted. There are dedicated car parking spaces at the side of the cancer centre, which are accessible via Infirmary Street. Please ask about permits for these spaces, which entitles patients coming for treatment to park for free. If you are attending for your first consultation, pay-as-you-leave parking is in place on the main car parks, and the ticket machines take cash and cards. There is access for disabled parking available as well. There is also a number of bus routes that stop at the hospital, and we are accessible by train from Carlisle station. Please ensure if you are using the disabled bays, your blue badge is clearly displayed. If you are attending for your first consultation, you will enter from the front of the Northern Centre for Cancer Care, North Cumbria building. It is important that you check in at the main reception. If you are attending for a pre-treatment or treatment appointment, you will enter the building at the entrance at the far end of the radiotherapy car park, and you follow the signs to the right along the link corridor. The radiotherapy entrance is clearly visible by a bright yellow wall.
I think the centre's a really welcoming place. It's a beautiful building. We aimed for it to feel more like a home from home as you enter into the building. There's comfortable seating. The reception desks have been designed to look more like maybe a hotel reception than a hospital reception. You'll meet friendly staff when you go in for your treatment. As we've said, if we can make that room look as less clinical as possible, then hopefully you'll have a relaxing experience. And the thing that we really do pride ourselves on is caring for the patient.
What is radiotherapy? Radiotherapy is the treatment of cancer using high-energy X-rays. The consent process forms a large part of your first consultation. It will be carried out by a clinical oncologist or specialist radiographer and confirmed by your treatment radiographer. This is to ensure you receive all the information you need to make an informed decision about whether to go ahead with your treatment. You will be treated by male and female radiographers, and there may also be students present.
Okay, so you're happy to go ahead with your treatment and everything?
We will discuss with you the benefits, side effects, and alternatives to having this treatment. We will also explain what happens if you don't have the treatment and what happens if you choose to go ahead. Your first appointment will be for pre-treatment. Some patients may need to have special devices tailor-made to help keep you in the correct position for each treatment. These devices are usually made in the CT scanner room, where you will also have your planning scan. This process is sometimes referred to as the mould room.
Have you got any questions, Billy?
No.
Lovely.
The mould room. For certain types of cancer, like head and neck cancer, you may need to wear a mask. This helps us to provide accurate delivery of treatment on every visit. For other types of cancer, you may need to wear a specially made mould, shell, or shield during your radiotherapy to help keep you in the correct position or to protect parts of your body around the treatment area. It is important to keep the parts of the body being treated as still as possible.
So you might visit us in the mould room because we may need to try and keep you as still as possible and reproduce your treatment position when you come for your radiotherapy. It's all in one appointment, so you'll go into CT, you'll meet the mould room team there, we'll make the mask or the back bag what needs making, and then we pass you over to the CT team, so you're not to-ing and fro-ing in between different rooms.
Planning a course of radiotherapy treatment is very important because it ensures each treatment is given accurately. Your treatment is planned by a team of radiographers and dosimetrists under the supervision of your consultant. The planning scan involves the use of a CT scanner to identify where we need to treat. A CT scanner is a donut-shaped X-ray machine which is used to take pictures that the team use to plan your treatment accurately and to target the area that needs to be treated. This procedure takes about 10 minutes and is completely painless. The therapeutic radiographers will have checked the referral from your doctor and they will ask you to confirm your consent. They will also explain what clothing needs to be removed and help you achieve a comfortable position, which you will repeat each time you attend for treatment. Keeping still for the scan is very important, so if you are not comfortable, please tell the radiographer and they will try and make some adjustments. The planning scan. It is important to take your usual medication on time before any appointment. Please also bring a list of all your current medication and planned medication. You can eat and drink normally before your appointment unless we advise you otherwise. We will highlight if you require a treatment where it is not recommended. You are very welcome to bring a friend or relative with you. We do ask them to wait in the waiting room while we perform the planning scan. You may be required to remove clothing for scans and treatment. You will be treated with dignity and respect at all times. Some patients need to have a planning CT scan with contrast. This involves an injection of a drug which enhances the appearance of some internal organs on your planning scans. This aids the clinicians in defining the area that requires treatment. If you need to have a contrast scan, you will be told about this when you attend for your planning appointment. You may be asked to remove jewellery, watches or hearing aids before your appointment. If this is the case, staff at the appointment will let you know. You may find it more comfortable to leave these at home. At the end of the planning scan, the radiographers will make some small tattoo marks to help the treatment team to position you when you come for treatment.
The permanent marks, the tattoos, we put them on a stable position on your body to make sure that we can then get you back in the same place when you have your treatment. So they are very important. You might not think so, they're only 3 little dots, but they are very important for us to be able to replicate that position when you come in for your radiotherapy.
Permanent marks. We need to put tiny marks on your skin to help us deliver accurate treatments at every appointment. This is done using dots of dye and will be permanent. The tattoos are very small marks, about the size of a freckle. Treatment scheduling. Some treatment can be delivered on the same day. This can take some time, however, and you will be required to wait while your treatment is being planned. Other treatments take place over a set period of time. Your radiotherapy treatment may involve a single visit or multiple visits, dependent on your treatment plan. There is a dedicated team of therapeutic radiographers and dosimetrists who specialise in making the treatment plan. Every plan is made specifically for the individual patient. The team work with your consultant who will approve the plan and prescribe your dose of radiation. Once the plan and prescription is made, a series of thorough checks are completed before you commence treatment. A team of therapeutic radiographers will treat you. We are a small team in Carlisle, so you will get to know your treatment team well. You will be asked to lie on the treatment couch, and the radiographers will use the skin marks to position you in the right place under the treatment machine. Treatment times are usually very quick. You will be in and out of the room in about 10 to 15 minutes. Most of this time is spent getting you onto the treatment couch and positioning you. The treatment radiographers run through a series of checks before they leave the room. The treatment itself only takes a few minutes. You will feel no pain or discomfort. We ask you to breathe normally and to keep as still and relaxed as possible. Most machines make a noise. This lets you know the treatment is taking place. You will be alone during your treatment, but the radiographers will be able to watch you and listen via an intercom and closed-circuit camera system.
So it's quite a big room where the LINAC is, so the LINAC's the linear accelerator that delivers the treatment. It's got a couch in the middle of it where the you'll be lying down and having your treatment, and then we'll sort of be manoeuvring you to get you into the right position. But then we have to leave the room to deliver the treatment and to take the images, because that's radiation being delivered, and obviously we can't stay in the room. So we then leave through those doors that then close, and we're just the other side of that wall, and we have cameras up that can see you at all the time. So if there's any problem at all, you just need to wave and we come straight in.
Your doctor or specialist review radiographer will see you regularly in the outpatient clinic during the course of your treatment. These appointments will be planned to coincide with your visits to the department. This is your opportunity to discuss any concerns you may have and for us to assess how you are tolerating the treatment. It is also important you tell us about any medication you are receiving, and also if you have to attend other hospital appointments or attend for any other investigations. Your consultant will have discussed any potential side effects from your treatment with you. Not everybody gets side effects, and this does depend on the treatment site. There is more information about side effects in our other video. We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you're running late for your appointment, just let the department know, and please don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.